Well, the National Institute for Communicable Diseases says it's clear South Africa is now heading very quickly into the fourth wave. Dr. Aslam Dasoo from the Progressive Health Forum joining us on this. Dr. Dasoo, always good to have you with us. And I'm sure you're going to agree with me when I say we shouldn't be surprised at the increase in numbers, because we knew this was going to happen earlier in the year, didn't we?
Good morning. Yes, we certainly did, and it's arrived practically on cue, though a little earlier than expected, and that's also not difficult to explain. We've had an election with a lot of activity before then, and precisely 2 weeks after that, we saw the uptick in infections, and of course the new variant, which seems to be driving it.
And help viewers understand at the moment just how much worse the numbers, the science is suggesting this could get. I was hearing figures that we could be in the upward region of 10,000 per day by the end of the week. And if we look at last night's numbers, Doctor, it looks like it's following that trajectory almost to a T.
Yes, very much so. In fact, it's moving very swiftly. Clearly, it's across the entire country now. Detecting it is always after the fact of its spread. And that's the same abroad as well. When they're picking up one case in California, I can assure you there are thousands. And in fact, this is something people mistake. I think they go by the road of the official figures that come in. But if the official figure is 10,000 per day, you could actually multiply that by a factor of 10 to 15 to get the real number of infections. Now you get a sense with a variant with a reproductive rate of 2 or above, and what that will mean. So 20,000 cases per day is pretty much what we saw in the third wave, and this perhaps has the capacity to exceed that. And I mean, the close monitoring of it is one thing. The preparedness of it is another.
And this is where, Doctor, I'm so glad you used the word prepared. I was actually going to ask you about preparation and prevention as well. If we all knew, and we all know, based on the science, based on the data, that we were going to get to this point now, I will talk about Omicron in a moment. How should government be handling get-togethers? And obviously I'm going to cite the Belito rage, which had to be cancelled. They said before the event that all protocols are being followed. We were even told by the CEO that South Africa must calm down. 24 hours later, there's 36 people that have COVID-19. This is why events get shut down, isn't it? Because the science is there, the data is there, and we have organisers who simply ignore the advice.
Yes, and I think if you just go back to the president's last announcement, I think it was a very measured announcement. It took on board the science that we know and the experience we've had. So keeping the restriction levels to what they are right now was actually a very good thing to do. But introducing the question of vaccine mandate, we can talk about that later. But these events, I mean, I just caught the latter part of that interview with the CEO of the rage, I presume it was in Belito, saying we should all calm down. Well, I've got news for him. We've known this was going to happen. This was a ticking time bomb. It was absolutely certain that there would be spread. And I think trying to negotiate with a virus is a mug's game. We know what was going to happen, and here's the interesting part. We have the Disaster Management Act in place that gives the government enormous power, constitutional power, to act rapidly in the interests of public health. That they allowed this to continue was very surprising. And the fact that it was shut down even after a day, well, that's welcome. But all these kids now have to fly back. A number of them are infected. They will go home and infect others around them. We've seen this last year. It was exactly the same playbook. And there were deaths of parents and grandparents arising from that kind of thing. So this is very, very serious. It can't be taken in a cavalier manner. Now, we know that this rage that's planned in Plet is going ahead. They're quite comfortable that they've got all the tests in place and they've got everyone vaccinated. Well, guess what? The virus doesn't respect geography or class either. this is also a ticking time bomb, and we urge the authorities to prohibit the gathering right now. Send the kids home right now. Reach out to those families, make sure the infection risk is low. It's tough on parents who are going to lose money. I feel for them. But unfortunately, people should have known about this. We are in the fourth wave. Categorically, we have to behave like we are in the fourth wave.
And I think a word of advice to the parents as well is don't wait for it to be cancelled. As the parents, take the call, make the call, pull the kids out of these events as well, especially the one down in Plettenberg Bay, basing it on what we saw in Belize. Doctor, very briefly before I let you go, I apologise for asking a loaded question with almost no time left. You mentioned mandatory vaccinations. Your thoughts on that? Is that where we need to go before I say goodbye?
Unfortunately, I believe it is. It would have been excellent if there was a huge voluntary response, but that we see has now stalled, and we are desperately under-vaccinated. So I think mandatory vaccines, which are a standard procedure around the world, and for everyone here, you vaccinate your children so that they can go to school. You can't get them into school if you don't vaccinate them. So you do experience vaccine mandates. You know about them. So this is nothing different. And people shouldn't make a big mega hoo-ha about this and just cooperate. If we get our vaccination rates up to a particularly high level, we mitigate all of the negative effects of this emergency phase and perhaps can get out of it a lot sooner. So let's cooperate. There has to be a public effort here. Everyone is a rational being, and I think there's enough information out there to know that a vaccine will prevent you from getting severely ill. It'll prevent you from spreading illness, and there's really no question that we need to go in this direction. The government should not prevaricate. They should move with this quite rapidly. They've been talking about it for months. Yeah. It's enough now. We know what needs to happen. They need to proceed.
Yeah, it's nothing new, COVID-19. We know what happens if we don't all do what we need to. Dr. Aslam Dasoo, thank you as always for joining us here on eNCA.